Welcome to our channel Quaint. Today we are going to explore one critical topic. The topic is deep vein thrombosis. In short, this is known as DVT, deep vein thrombosis. That means we are talking about the medical condition where veins, especially the deep veins, are affected. So what happens in case of deep vein thrombosis? Thrombosis means clotting of the blood. When blood clots in your veins, in that case that is known as thrombosis. So in most of the cases this occurs in our lower extremities. That means either thighs or calves, means in the legs. This happens. Various reasons are there for which this may occur, and various diagnosis techniques are there. Okay, and if this medical condition is left untreated, because in most of the cases this is not treated properly, this is not taken seriously by even the patients, and if this is left untreated, then in that case this medical condition might be proved to be dangerous. Even it can lead to your death. Yes, it can lead to your death. One very serious complication is pulmonary embolism. If left untreated, this medical condition I am talking about right now, deep vein thrombosis, this may be inherited. Suppose the patient or the person I am talking about is suffering from hypercoagulability, means there is a tendency of that person, of that person's blood to clot itself in their veins. In that case, so this condition is known as hypercoagulability. In such case, that person may suffer from this deep vein thrombosis problem. So this is one case. Again, in case of a long-term immobility of your legs, I am talking about legs. You may think about your whole body, such as for long haul flights. Okay, or for suppose you have already undergone surgical operation, and for that purpose you are taking a rest for a long time. In all these cases, immobility is there. That means your body has become immobile. Movement is absent. Okay. So in such cases, there is a chance of DVT. So clinical examination can detect this problem, such as on the site swelling may be observed, pain may be observed, redness or discoloration may be observed. Different tests are also there, such as a D-dimer test. D-dimer test actually, this is not a good test. Still, this test is done. D-dimer test. Here, what is done? Actually, blood sample is taken and it is checked whether there are particles of clotted blood or not. Okay, so that is called D-dimer test. So if a high level is present in D-dimer test, then it is assumed that you are suffering from the problem of DVT. But as a gold standard of recognizing or diagnosing this DVT is ultrasound with Doppler imaging. Ultrasound with Doppler imaging technique. This is taken as a gold standard for DVT. Anyway, so many tests are there. So clinical tests are there. Again, other diagnostic methods are there. Okay. So these patients can be treated by administering them with anticoagulants like heparin, warfarin are there. They restrict further clotting of the blood. Okay. So heparin, warfarin, these medications may be administered to the patients. Then again, compression stockings may be used. Exercise may be recommended to the patients. Again, in case the patients cannot tolerate the effect of anticoagulants, in that case IVC filters may be prescribed. If IVC filters, in that case either anticoagulants or IVC filters. Okay, so these filters the particles of the clotted blood from this prevents from reaching to the lungs, because if clotted blood or the particles of the clotted blood or the thrombus reach to the lungs, in that case there will be a problem, or that complication is known as pulmonary embolism. You may suffer from the problem of oxygen exchange, means respiratory problem may be there, chest pain may be there, even a cardiac arrest. Okay, you may also suffer from cardiac arrest. So different kinds of problems are there, and all are very serious problems. If the clotted blood or the part, means a part of the clotted blood reaches to the lungs, in that case there is a in that case that becomes very serious issue. Okay, so whenever it is recognized, this symptom, and sometimes, of course, one more thing is there. Sometimes this condition DVT is asymptomatic, means symptoms are not observed. Symptoms of DVT are not observed. Symptoms such as redness or the discoloration, or then again pain, swelling, these are not observed. Still that the patient is suffering from DVT. Various causes are there, such as smoking, pregnancy, it may be inherited, okay, long time rest. So for different reasons are there for which the person may suffer from such problems as DVT. But what is the main purpose of making this video is to warn everyone about this problem. This problem is not this problem is actually a very serious problem, though it is not recognized very well by most of the people. Okay, means it is a less recognized problem for many of the people, but this might be proved to be very serious. Even it may cause your death. That's why this is very serious problem. Anyway, so different, I have already mentioned that different treatment procedures are available. Okay, again thrombolysis, this may also be adopted for the treatment of the patient. Okay, means dissolving the blood clots, right? And the patients undergoing bed rest for long term. So in such cases, prophylactic coagulants may be prescribed to those patients. Okay, because since body movement is absolutely absent in such cases, in future there may be a problem of DVT. So in such cases, as a preventive measure, prophylactic coagulants may be administered to those patients. And so I think I have already discussed almost each and every aspect of this problem, and I have discussed here only one serious complication, that is PE or pulmonary embolism. Okay, there may be other problems also. Those things will be discussed later on this same channel. Okay, so anyway, so this was all about today's topic, DVT or deep vein thrombosis. Okay, so this is the end of this video. Thank you for watching this video.